When a patient first comes to see me for early stage breast cancer, it's often a little overwhelming. Many times it's the first time a patient has ever been sick, and all of a sudden they're dealing with lots of things. They're dealing with surgery to a very sensitive body part. They're dealing with possibly radiation, and then systemic therapy, which can include chemotherapy, targeted therapy, anti-estrogen therapy that messes with your hormones. So it can be quite overwhelming. And so I often encourage patients, to kind of recognize that fact and take it one step at a time. For many women who have been, the rock for their families and the strong one for everyone else around them, they sometimes need help, and that can be hard to admit. So I kind of try to bring that to the forefront just so people can kind of cope with things as best as possible. And then kind of talk them through each step of the game, whether it's surgery first or chemotherapy first or what have you, to encourage them to sort of see the forest but also see the trees, so taking it one step at a time. And I'll often give them like a little handout at the very first visit to kind of highlight all those different things that they will go through over the next 6 months or a year or whatever it is, where they'll be in intensive therapy with us to try to cure their disease, and try to highlight what each portion of that will look like. But then from that point forward, kind of focus a little bit more on the here and now. How are they going to get through this cycle of chemotherapy? How are we going to deal with these side effects? How are we going to help them integrate the cancer into their life and then hopefully move beyond it?